I came from Italy. After my graduation and my research on lung transplant, I had an aortic fellowship job in London, and that's where I fell in love with aortic surgery, and that's what I decided to do. But core surgical training challenged my plan, because I basically fell in love with everything I was doing. And when I eventually got into vascular surgery, I found that a perfect balance of everything: operations, approach, medical and surgery challenges, and also the surgeons were very much a friendly community compared to what could have been cardiothoracic surgery. There was another possible solution for me, or general surgery. They were always so busy all the time with crazy on calls. So the vascular surgery has just been an answer on the perfect balance that I was looking for. I've been asked this question the whole week, and I didn't come up with an answer yet, because I would love to come into a day when I do 4 fistula, patients coming in and out the same day, and I would love to do a rupture and challenge myself. Today my answer is just going to be probably a femdistal bypass on an emergency situation. That's my answer today. That's what I would do now if I got the chance. Saving someone else's life, saving someone else's leg, for definite. Having a patient that comes to ED that has got a dead sentence like a rupture, and find him awake the next day in intensive care and just explain that you saved them their life. That's the most rewarding moment on my daily basis. Again, balance. The biggest challenge I face is to follow my passion of being a vascular surgeon and a busy surgeon, and be a father and a husband. So that's the most challenging thing for anyone who's got a family and a busy job like ours. So that is difficult. It is a busy life. There's no way around it. It might get a little bit easier once you are a consultant, but as a registrar of junior doctors anyway, it's very difficult to find that balance. And there's a lot to sacrifice, there's a lot of free time that it will be gone forever. But the most important thing is to stay happy. If something happens and you're not happy anymore, maybe you shouldn't be doing it. So I'm a less than full-time trainee, because I want to spend a bit of time with my daughter at least one day per week. So apart from day off, I work 60 miles from home, so I drive 2 hours a day to get to Norwich from Cambridge. If I'm on call, at the moment I deal with 40 patients in a ward round, deal with referrals and emergencies. If I'm not doing that, that means that I'm operating with elective patients or in clinic. And anytime I've got some spare time in the hospital, I try to get some projects started to fulfill the research that I need to carry as part of surgical curriculum. Any free time is a time that I use for something. I don't just let days passing by with no plan of doing something interesting with my family, with my friends. I used to travel a lot. Obviously COVID has messed up with that a bit, so I got into sports and I see a lot of friends. So I never let a day on the couch watching the telly. I don't have a telly. It's difficult, there's no straight answer. The advice I have to give to everybody is just don't care about the money. It's very expensive to have a child and be a trainee, because especially for someone that hasn't got parents in this country that can help out, a whole salary will go for childcare, and it's gonna end someday and somehow. Don't worry about that. That's not solution around the money issue. There's little support that you get for childcare, and that's just the way it's going to be. Don't be upset. Apply for less than full time. You don't really need to have a reason nowadays to be less than full time. That's an advice I give to all the junior doctors really, but especially if you are parents, you cannot have 100% working time. It's just too much. You will have a breakdown. And make sure you get all the support you can get, and challenge your setup on a monthly basis with your supervisor, because they need to be aware of your difficulties, and they can advise you, and they can accommodate any sorts of requests or arrangements that it might be help you out. So it's being a challenging life. I would just advise to stick to your idea and your passion. The best advice I can give you is find a mentor, find a person to aspire to, and always being open to challenge and discussion, because maybe what's your idea of surgery, it's wrong, it's different, it doesn't suit you. So be always open mind, challenge yourself, question if you're in the right pathway, and don't be afraid to change your mind and come to Vascular.